Hi guys, welcome back to my YouTube channel. Welcome back to the journey of an auxiliary nurse. Welcome back to the entertainment channel. My name is Malebo Mgona, the first enrolled nursing auxiliary YouTuber in South Africa. If you are new here, hi, welcome. Please stay. You might like it here. And if you have been here for the longest, thank you so much for choosing me. Please don't forget to hit the subscribe button. Don't forget to hit the like button before you leave. Today we're doing a very quick video, I hope. I will be explaining about how auxiliary nurses work in hospital. It's me talking about my experience as an auxiliary nurse at a private hospital. I don't know how they work at government hospital or how they work at government clinics or anywhere else. I am talking about my experience as an auxiliary nurse who work under a nursing agency and who have worked for various. I think what most people want to know is the day-to-day work that auxiliary nurses do in hospital. As you know by now, nursing is a routine. Nursing is basically what you do on various people every day, on different people every day, right? Right. That's how I view nursing. Nursing is a routine. It's something that you do, and as you do it more often, you start to perfect it, right? Right. Okay. I think most people ask on Google, what do auxiliary nurses do? Apart from the other question that comes after that. So I will be focusing on only one question. What do auxiliary nurses do? Okay. Basically what we do is, I'm going to explain the whole routine of what we do, right? When I used to work at a private hospital, when we get in, first thing you clock in, you punch in the number that you are going to work at. Like the unit has numbers. So if it's surgical ward, it used to be 14, I think. So yeah, you will punch in 14, whatever ward that you're going to work in. Immediately after clocking in, you go to your unit. That means your routine starts. There's no such thing as "Mara ke tlile ka 6 and my routine start at 7." No, the routine start. Quarter to 7, it's report. Report is taken by everybody in the unit. Everybody in the unit take a routine. A report. A report is basically information of what was happening before the next shift came. Like during the day, if there are new admission, if there is change in script, if there is something that needs to be implemented, if a patient who have been there for a while are going home, things like that. So you need to know what was happening before you took over, right? Right. It's from quarter to 7 to 7 o'clock. I don't know if things have changed now since COVID happened, but yeah, from quarter to 7 to 7 o'clock, that's a report, right? From 7 o'clock, we all know it's visiting hours. Visiting hours starts from 7 o'clock to 8 o'clock, right? So that time, it's when we allow visitors to go in and see whoever they want to see and ask questions and request for whatever they want to request. Like they will often request for an extra blanket for the patient or an extra pillow, a glass of water, coffee, like anything in between, right? Right. But we as auxiliary nurses use that time to put away our stuff, to make coffee if we have to eat your lunch if you have to, lunch, breakfast, midnight snack, or whatever that you eat, right? Because 8 o'clock, the real work starts, okay? When you hear the bell ringing at 8 o'clock or nurses kicking you out, that's because of we know there's still a lot of work that needs to be done after 8 o'clock. And we cannot lose any time because from 8 o'clock to 10 o'clock, we are working. 10 o'clock lights needs to be off. So we cannot waste any extra time giving you extra 15 minutes, extra 20 minutes. You understand? Fine. It's 8 o'clock. Everybody has left. Now we start to change the bed linen and take vital signs, right? We go in with our machines. We go in with everything that we will need to change the bed, right? We change the bed. While we do that, if you are paired in twos, before you change the bed, somebody take the vitals and then you unstrap the bed. If especially in wards that most of the patient can do for themselves, like sit by the chair or walk around or do such thing, we will often request them to sit on the chair and then we unstrap the bed and then we take vital sign, right? And we change the water if we have to, like drinking water. If we have to, if the patient didn't eat, maybe supper or whatever, or the patient just got in, maybe just got admitted in the unit, we call the kitchen and we call for food and things like that, right? That's the routine from 8 to 10. And you'd find in a unit, it's a 30 bedded, 32 bedded unit, right? So you need to do all that for 32 beds or Sometimes you'll find 4 or 6 bed are open beds, or maybe the patient just came in. We won't change. So don't come asking for us, yeah, you change all the beds for everybody else, but you didn't change for so and so. That's because so and so came in today, right? Let's understand it. That's because so and so came today. So we can't change the bed linen whereas a patient just got admitted. The bedding is already clean, right? Right. And then from 10 to 12 o'clock, we do filing. We chat. What we chat is we update whatever changes that happen during the day. I mean, whatever changes that happen during the period from 8 to 10. Or if maybe you changed, some have nappies, some have wounds, some have catheters, some have various things. So you check that, you record that. You record that you maybe emptied the catheter, you changed the nappy, or the patient was wet or vomiting, whatever changes that happen to a patient during that period, that's when you record, right? And guys, you need to always have a book on the side or a piece of paper on the side and a pen to always write whatever observation that you maybe see on a patient or find in the room, things like that, right? 12 o'clock, we tend the patient. If they are bedridden patient, like patients sitting on the bed for a long time, you tend them. We tend them when we change the bed around 8 to 10, and then we tend them again at 12, right? At 2 o'clock is the second routine. That's when we take vital signs, and then we tend them if we have to give them back massages, massage the food, change whatever that needs to be changing, being it a nappy or whatever. Remember that people who are often on nappies are like babies. So if you change your baby 4 times a day, 8 times a day, that's what you do even with an adult. You need to change them regularly because it's not nice sleeping with a wet nappy the whole night or wet clothes or whatever. So some do it to save nappies because apparently nappies are expensive. I don't know. I've never used a nappy, but people who bought nappies, like families who came maybe with patients who need nappies, they will often tell you nappies are expensive, so please try to use them sparingly and whatever like that, right? Right. And then we record again from 2 to 4. We record again. Now the real work starts at 4 because you often find that there are patients that needs to be bathed. That's a real challenge. Patient need to bath. I get because 7 o'clock to 8 o'clock again in the morning is visiting hours. Okay, but most hospitals don't do that. Like I think 7 o'clock to 8 o'clock for day shift, it's theater time. Theaters, I think mainly they open at 8. So around that time, you need to prepare your theater patient and things like that. I don't know. I'm not sure. I haven't worked day shift for such a long time to know what the routine really is about. Yeah. So 4 o'clock, we start our last routine whereby we bath patient, we change bedding that needs to be changed, we close off our files from yesterday 8 o'clock to 10 o'clock, 12 o'clock to 2 4, things like that. So yeah, that's basically the routine that happens in private hospital, and more. There's more. I'm sure there's more, but I was just trying to summarize it so that you have an idea. If you are an auxiliary nurse or you are planning to become one, that is basically the routine all around. There's no special treatment whereby you'll be sitting on a desk taking vital signs only and doing no. You bath patient, you feed patient, you change patient, you answer to bells. Guys, it's a lot. It's a lot. But I am glad that I had the pleasure to be an auxiliary nurse, and it's nice to me. It's not even a burden. Okay, it's sometimes painful when you help a patient and they don't say thank you, they swear at you, or they give you nasty looks and things like that. But I look at it in this way. You brought your family members to be taken off because you couldn't, right? So I have to be the end part of that. I have to do my part. I have to give the patient the best care possible. And I try by all means to do that, even though I also get annoyed, but I don't mistreat patient because I'm annoyed. I don't beat patient because I'm annoyed. I know people who do that, but that's a topic for another day. I don't do that. So thank you so much for watching. I hope this video is not long, and I hope I gave you an idea of what happens behind closed doors, behind auxiliary nursing. Thank you so much, guys. Please don't forget to hit the subscribe button. Don't forget to hit the like button, and also don't forget to comment. Thank you. I'll see you on my next one. Bye.